my good friend Patricia Berryhill and I, we decided once Charity Hospital was closed, we knew the Lower Ninth Ward was going to be one of the places that would receive any help. They would probably be last on the list, as they usually are. And we saw what happened, like I said, at Convention Center Boulevard and the Superdome. And we saw people just waiting for the bus that never came. So we decided not to wait for the healthcare bus, and we started our own clinic. We saw that post-Katrina, the care was very fragmented and inadequate. We saw that the response from our federal government was sorely lacking. And I have to commend our city health department, because I know they were trying the best that they could, but they just had inadequate resources. The other challenges that the city faced post-Katrina was that there was a decreased number of medical providers. That's from doctors, nurses, x-ray technicians, pharmacists, you name it, because many of them relocated to other cities and the grass was much greener. They decided not to come back. New Orleans was already an underserved and unserved medical health area, and post-Katrina it was even worse. We also found out, because of Katrina, just like with everyone else, there was a lack of physical buildings. That was one of the biggest challenges. Where were they going to put the healthcare facilities? Also, one of the big problems that we've had post-Katrina with the closure of Charity Hospital is that the patients don't know where to go. Many of the services were not available. Many of the specialty services like orthopedics, OB/GYN, ophthalmology, you name it, many of these services were not available. And if you did not have insurance, you had to go out of town to the nearest charity hospital facility. Probably the most scarce specialist is the psychiatrist here today. Also, we found out that many people who had insurance pre-Katrina had lost it because they lost their jobs. So we had a new population of people who needed free care or some type of assistance, monetary assistance, when they were trying to access health care. When we started to see these patients coming in, it was truly a very devastating thing, because what we found was, because many of the folks were not able to access primary health care, their health had deteriorated. I mean, it was folks who could have been treated but weren't treated. So now we're seeing them in a worsened state of health, where their organs are involved, and there's problems with their labs. There's other health problems and issues that have been worsened because they have not been able to contact a primary health care provider. So what we decided to do was to educate and equip our patients to take care of themselves. So when Secretary Levitt came down, our United States Secretary of Health and Human Services, he asked us, well, do you want to go back to the charity hospital system? And I basically said, why would we want to go back to that type of system if it's going to be the exact same thing? Because we did not have good health outcomes. I feel that the neighborhood clinics are probably the best thing for our residents right now. It's easy for them to access. They'll probably have more compliance with them coming to the clinic. They'll become familiar with their providers, and their providers will become familiar with them. And I believe that they will do much better. We have found that many of our patients are so depressed that has also prevented them from accessing health care. They have this underlying depression. We have seen it in the clinic. We've worked with folks who actually had suicidal ideations, and we had to get help for them immediately. But what happens is, we just decided we couldn't continue to go on like this and allowing this to happen. That's why we decided to speak out and speak up on their behalf. We also don't have enough social services to really assist people who need it, because we know that health is not just determined by your physical well-being, but also by housing, education, environmental concerns, just to name a few. So actually, we have to really work in a multidisciplinary type setting with different healthcare providers to make sure that we are there to take care of all of the patient's needs. We need a charity hospital, a hospital that is a level 1 trauma center. However, we do not need the same type of protocols that they were using there, whereby everything was centralized. We have to decentralize the care. We have to put it out in the community. Lower Ninth Ward Health Clinic is here tonight because we made a promise to the folks in the Lower Ninth Ward. We decided that we were going to be advocates, educators, and change agents, and that we were going to speak out and speak up on behalf of the citizens of New Orleans and the surrounding areas who need health care. We realized that we can't do it alone, and that nobody fights better for you than you. And I'm so pleased to have been here today, and I'm willing to partner with anyone who is here who wants to increase our access to health care so that we will have better health for the citizens of Louisiana. And with that, I thank you.